In the past, when you received a CT scan at the HSA, you received a one-dimensional black and white film like this one. But now, thanks to new technology, 3D colored images are available.
This new 64-slice CT scanner is part of one of many things that we're doing here at the hospital to create new futures for healthcare in the Cayman Islands. The capability this machine brings is quite remarkable.
This particular CT machine is a 64-slice CT machine. Before now, we had a single-slice CT machine which had limitations. If you imagine the body as a loaf of bread and you slice through that loaf of bread, you will produce slices, and that's exactly what the CT scan does. If you were to take out one slice of that loaf of bread, it would be equivalent to one image for each rotation of the tube of the CT scan. The person's body lies under a large box with a hole, and the X-ray tube circulates around the body, producing that image from different angles. So we get tremendous detail, and we can see structures in the body which before now were difficult to image. This helps us a lot especially with vascular studies, where speed is important. We're now able to do CT scans of the heart, which is beating, it's moving, but we can time it so that those slices are taken when the heart is in a rest phase in between beats. And so we're able to show a lot of cardiac abnormalities even in children. We are also able to study the blood vessels to the brain and to any part of the body because we can do this rapid imaging. We can also do very thin slices down to 0.64 of a millimeter.
We're looking at creating new futures through new partnerships, through new technology, through new ideas and the facilities improvements. We're putting together a master plan to sit down and say, okay, which parts of the hospital are getting a little bit old, so that we can program the advances and the improvements in our facilities. Right now we have a number of projects going on. We're fixing the roof in our IT department, the general practice clinic, and a couple other places as well. We have some exciting changes happening in the dialysis unit. And then we have some other new technology, some of which we've been very fortunate to be beneficiaries of donations from business community. For example, the new blood gas analysis machine, which is a portable unit down in the A&E, which allows much faster turnaround time for some of our most critically ill patients and allows the doctors to make quicker decisions without having to send the blood up to the lab. We have a new machine in the eye clinic called a phacoemulsifier. That's a great advance. It's an improvement in patient safety.
We use a machine called a phacoemulsifier to remove cataracts from inside the eyeball. And the basic principle is that the cataract has to be broken up inside the eye, pounded, and then removed, aspirated. The machine that we were using before was about 10 years old and had become gradually obsolete. The handpieces were wearing out, all the equipment was slightly worn. So we were looking to get a newer, more refined, more safe machine, and this Alcon Infinity gives us much better control over the amount of surgery and the quality of the surgery that we do. It should improve the outcomes in the sense that we have fewer complications, and will also improve the recovery that patients have after surgery. I've been using it for the last 2 weeks, and all the patients that I've operated on have had successful surgery. They've had increases in their vision, and they've been very happy with the results so far. I mean, it's not really a voice-activated machine, but it actually gives you a commentary of what's happening during the surgery. So as a surgeon and as a patient, you can hear what's happening. If they come to the eye clinic, they'll have a UK-trained consultant. They'll be treated with equipment which is state-of-the-art. I think we are offering surgery, and we're offering diagnosis and treatment which is on a par with anywhere in the United States or the UK. And the technology that we have available now, and we are going to receive in the near future, will offer them the same level of service that they would obtain if they were to fly off to the United States or to the UK.
We sent a lot of patients away, a lot of neurology patients with problems in the brain which the old scanner was not competent enough to diagnose. We had to send them to Miami at tremendous cost. So this will be better for the patient's pocket and the insurance companies that we can diagnose so much more here now.
Right now, HSA officials are working to bring similar technologies to the sister islands.